I'm Dr. Chris Schock. In this tutorial, I'll discuss perioral dermatitis treatment options. So let's take a look. Again, perioral dermatitis is a rashy type of acne, if you will, seen most commonly in women and children. So what are we going to do about it? Well, often people have used topical cortisones to try and treat the condition, and this will give some temporary improvement. Unfortunately, the longer you use topical cortisone on perioral dermatitis, the worse the condition tends to get. So we have to kick the steroid habit. So when you stop the topical steroids, you have to prepare for the flare, and this can last sometimes 6 weeks. But with some additional therapy to control the flare, we can usually make it a little bit better. So how are we going to start? Well, number one is gentle skin care. The skin tends to be quite sensitive in patients with perioral dermatitis, and so trying to exfoliate is not a good idea. We want to use a soap substitute, a very mild soap when we wash the area, and we want to wash with the hands and pat dry with a towel. No abrasives when we're treating the skin in this region, and you want to avoid anything that touts anti-aging properties when you're treating perioral dermatitis, because anti-aging creams tend to irritate the skin. They don't cause perioral dermatitis, but they can cause greater irritation. So we've talked about that. Avoid irritants. And again, over-the-counter acne treatments also tend to irritate the skin in this region. Unfortunately, there's not a great over-the-counter option for patients with perioral dermatitis. Topical antibacterials, we're not exactly sure how they work. They have some anti-inflammatory effect, but they probably affect the potential overgrowth or reaction to the normal skin bacteria that's occurring in patients with perioral dermatitis. Topical metronidazole, clindamycin, azelaic acid, erythromycin, dapsone, the list goes on. But these are more gentle topicals that we can prescribe for patients. Topical tacrolimus or pimecrolimus are non-steroid anti-inflammatories that we can prescribe in clinic. They are sometimes effective. Often it takes oral antibiotics to clear this condition. You have to be patient when you're dealing with perioral dermatitis. It usually takes about 4 to 6 weeks to really clear the condition, and people that have it are prone to flare-ups, so we're more likely looking at controlling the problem. So we usually use oral antibiotics for approximately 6 weeks, and then we'll have a topical plan that you will continue for maintenance, restarting oral antibiotics as needed for flare-ups. Again, there's no proven over-the-counter therapy available at this time.